Recording. Hi everyone, Mark Harvey here, giving another video for PMHNP students and nurses and anybody else that cares to learn about psychiatry and things like that. Okay, so schizotypal disorder. I've always said it's schizotypal, but a smart psychologist said it was schizotypal, which makes sense. Anyway, personality disorder. Personality disorders are one of the hardest things to learn how to diagnose. Let me share my screen. So schizotypal personality disorder is a cluster A, which category, odd or eccentric category. I don't know about those clusters. They're kind of pointless. But anyway, in the DSM-V, which is that book that you need to memorize in order to practice psychiatry, schizotypal personality disorder is a pervasive pattern of social and interpersonal deficits marked by, hey, my cursor, acute discomfort with, and reduced capacity for close relationships, as well as by cognitive or perceptual distortions and eccentricities of behavior, beginning by early adulthood and present in a variety of contexts. Okay, that's a personality disorder and schizotypal specifically. That's probably a definition of personality disorder, period. Except for perceptual distortions. We'll talk about this. These symptoms must not occur during the course of a disorder with similar symptoms such as schizophrenia or autism spectrum disorder. So if you have schizophrenia or autism, you don't have this personality disorder, but there are a lot of differences from autism and schizotypal or typal. And there are some important differences between schizophrenia and the personality disorder, schizotypal. Okay, so according to the DSM-V, at least 5 of the following symptoms must be present: ideas of reference, strange beliefs or magical thinking, abnormal perceptual experiences, strange thinking and speech, paranoia, inappropriate or constricted affect, strange behavior or appearance, lack of close friends, excessive social anxiety that does not go away, stems from paranoia. And these symptoms must not occur only during the course of a disorder with similar symptoms, such as schizophrenia. It's a cluster A, which is the odd or eccentric category. The term schizotype was first coined by this guy in 1956. So schizotypal is how I've decided is the correct way to pronounce the disorder. He calls it a schizophrenic phenotype. That's interesting. The ICD-10, a little different than the DSM-5, it says you've got to have eccentric behavior and anomalies of thinking and affect, which resemble those seen in schizophrenia, but no definite and characteristic schizophrenic anomalies have occurred at any stage. There's no dominant or typical disturbance, but any of the following can be present. The affect is inappropriate and constricted. The behavior or appearance is odd and peculiar. Poor rapport with others and a tendency to withdraw socially. Odd beliefs or magical thinking and behaviors that go along with that. Inconsistent with subcultural norms. So it's not just goth or something or like, you know, hipster. They've got their own style. Suspiciousness or paranoia, obsessive ruminations without inner resistance to the ruminations. So they're not trying to fight it. So some perceptual experiences, including somatosensory or other illusions, depersonalization, derealization, the stereotype thinking that's vague, metaphorical. If you've had a long conversation, as I have, with somebody with this personality disorder, you can it's hard to follow sometimes. It's circumstantial, metaphorical, elaborate thinking with the odd speech, and not gross incoherence that you might find in schizophrenia. Okay. Occasional but transient quasi-psychotic episodes with intense illusions, auditory or other hallucinations, and delusion-like ideas that occur without external provocation, but it's occasional and transient, unlike schizophrenia, where it's constant and ongoing. Okay, the World Health Organization owns the ICD-10. I did not know that they were the author, so I put that in there as a side note. I just learned that today. How did I not know that the WHO owns the ICD-10 and lets the US government borrow it? Okay, according to them, to the ICD-10, they use the name schizotypal disorder. It's classified as a clinical disorder associated with schizophrenia rather than a personality disorder, which is what the DSM-V calls it. So the disorder runs a chronic course with fluctuations of intensity, but it's a personality, so it doesn't go away. Occasionally, it evolves into overt schizophrenia, and apparently that's at about the same rate as the general population. There's no definite onset because this is a personality, unlike schizophrenia that often has a definite onset. And its evolution and course are usually those of a personality disorder. It's more common in people who are related to people who have schizophrenia, and it's believed to be part of the genetic spectrum of schizophrenia. So schizotypal personality disorder is a mental disorder with severe social anxiety, thought disorder, paranoid ideation, derealization, transient psychosis, and often unconventional beliefs. These people are not muggles. People with this disorder feel extreme discomfort with close relationships, avoid forming them, and they often think that their peers harbor negative thoughts towards them. Peculiar speech mannerisms and odd modes of dress are symptoms of this disorder. They react oddly in conversations. They may not even respond to you, or they may talk to themselves and ignore you. They frequently interpret situations as being strange or having unusual meanings for them. Paranormal and superstitious beliefs are common. So if they do have a conversation with you, sometimes you can go off on these pretty interesting rabbit trails of supernatural, paranormal weirdness. And so they don't seek medical attention for their personality because that's their personality, but they do seek medical attention for anxiety or depression. The disorder occurs in about 3% of the population and is more common in men. Yeah, I don't think I've ever, probably met a woman with it, but okay. Genetics is widely considered to be a part of the schizophrenia spectrum, or it's a schizophrenia spectrum disorder. Rates are higher in relatives of individuals with schizophrenia. Technically speaking, it's an extended phenotype that helps geneticists track the transmission of genes that are implicated in schizophrenia. So schizotypal is on the spectrum of schizophrenia. That's very interesting. Now, it's not schizoid personality disorder, and the differences, the reason I'm doing this lecture is because I'm unclear on the differences, but most notably is the inability to initiate or maintain relationships. That's the most notable similarity, friendly and romantic relationships. The difference is the schizotypal avoids social interaction because of a deep-seated fear of people, and the schizoid individual feels no desire to form the relationships because they see no point in sharing their time with others. I think this is nitpicking in my opinion, but yeah, okay, so one has a fear of people and the other one just doesn't care. The schizotypal personality disorder generally does not have the full-blown hallucinations that schizophrenia has. And like I said earlier, it can turn into schizophrenia. Yeah, and it's more common in people that are related to people that have schizophrenia. Okay. And that, oh, I ran out of screen. There, I was reading Wikipedia about it. You know why? Because Wikipedia is where smart people hang out. And you should support Wikipedia, because I do. And it's got a lot of great sources and resources. In fact, that's where I got most of the words on this PowerPoint. But the DSM-5 is handy. The ICD-10 is handy also, because you got to know the DSM-5 to practice psychiatry, and you got to know the ICD-10 to get paid for the practice of psychiatry. So again, this is Mark Harvey. I'm happy that you got this far in the video. I'm hoping to make more videos. I hope schizotypal personality disorder makes a little more sense to you, or at least maybe this video will inspire you to go look it up, because like when I started my psychiatry rotations, I really hadn't heard of it and had no idea what it was, and definitely no idea how to diagnose it. So there you go. Enjoy the rest of your day.